This is Jeremy with CryoClarity, and in this video, we're going to be going over the different chambers of the heart and different characteristics associated with each of them. So whenever we start looking at the right atrium has a few structures that characterize it differently than the other three chambers of the heart. The right atrium has what's known as fossa ovalis, and fossa ovalis is a remnant of the shunt in utero, which was known as foramen ovale. And this foramen ovale shunt in utero helped shunt blood to bypass the fetal lungs, similar to the ductus arteriosus, which the ligamentum arteriosum is a remnant of. Inferior to fossa ovalis, we have the opening of the coronary sinus. So this inferior refers to that the coronary sinus opening is inferior to the fossa ovalis. The fossa ovalis seems like a quarter-sized impression in the right atrium and will always be superior to the opening of the coronary sinus. Inside the right atrium, we also have crista terminalis. Crista terminalis separates the smooth from the rough, and it is analogous to the sulcus terminalis located externally. Also within the right atrium, we have pectinent muscles, and pectinent muscles are going to exist within the right atrium and the auricles, the right auricle and the left auricle, but they will not exist within the left atrium. The left atrium has no pectinent muscles. The right ventricle, its wall is 1/3 of the thickness of the left ventricle. Therefore, the left ventricular wall is 3 times thicker than the right. The right ventricle, other than having a thinner wall than the left ventricle, has trabeculae carneae contained within it. Trabeculae carneae are muscles within both ventricles. Therefore, the right and left ventricles will both have trabeculae carneae. That's what the TC under the LV stands for. The right ventricle also has the moderator band, and the moderator band is going to help with heart conduction or conductivity. The moderator band is also known as the septomarginal trabecula. We also have the conus arteriosus, also known as the infundibulum, within the right ventricle, and it's actually part of the right ventricular outflow tract as blood goes from the right ventricle through the pulmonary valve to the pulmonary trunk, which would then go to the pulmonary arteries before heading to the lungs.